Hello, my name is Jonah. I'm going to be your pharmacist today, and I'm going to teach you how to test your blood glucose level. So, first, you want to start by opening your pack, and you're going to see a bundle of 3 items, and then you're going to see some white plastic which has your lancets. So, first thing you want in your bundle is the lancing device, which looks like this. Then you have your test strip vials, and then you have your glucometer, which is where you read your blood glucose. So, first thing we're going to do is go to the lancing device. Before you do this, make sure that your hands are thoroughly washed with warm water and soap, of course. We're trying to stay safe in this pandemic. And the first thing we're going to do is take the cap off the lancing device. So, what you're going to do is put your 2 fingers on the top of it, and you're going to want to twist gently counterclockwise and then pull up. So now you've exposed the area where your lancet will go in, and you're ready to move on to the next step. So now we're going to put the lancet in, which is where the needle is. So I'm going to go over to my white pouch and pull out a lancet, and you're going to see that the lancet has 2 sides. Oops, sorry. Part. You're going to see that the lancet has 2 sides. It has a circular side and it has a more rectangular side. So what you're going to want to do is, with the circular side up, insert the rectangular side into the blue open rectangle on the lancing device. And you're going to push down, and now to remove it, you're going to want to twist it and pull up. So now you have your needle, and you can move on with the process. So first thing you want to do is put the cap back on, so just opposite of how you did it the first time. So you want to put it on and then twist clockwise until you hear a click. Okay, perfect. So now what we're going to do is we are going to cock the lancing device so that it is ready to release the needle when you want to test yourself. So in order to do that, what you have to do is pull back on this lever until you hear a click. It'll be very obvious when you hear it. Okay, and just to test, you press the white button and you hear it eject, so you know you're all set. So now it's primed and it's ready to go. And also the number on the bottom is how deep the needle will puncture. So it's with 7 being the deepest and 1 being the most shallow puncture. So that just depends on you. As you get a feel for it, you'll start to understand that better. So now I'm going to show you where you can test yourself. So most typically, you want to test yourself on your fingertips. There's arteries on the top of your fingertips, so you'll get a good blood flow, and it's not very painful. So the tips are the most common part. If I were to test, I would test just about right there, a little bit off to the side, not right in the middle, so it's not annoying after the test. Okay, so now that we have the lancing device set up, we're going to move over to the glucometer. So the first thing we're going to do, of course, is turn it on. And to do that, you are going to hold the OK button, which I'm about to do. Okay, so now that you see something appear, it is now on. So the next thing we're going to do is we're going to set up the time and date. So to access the time and date, you have to press the down and the OK button simultaneously, which I'm going to do. Okay, so now you see the time is blinking. So you can go up and down to change the hour, and then once you press OK, it goes over to the minute, then AM or PM, and then it will move on to the date. So I'm going to go ahead and do that right now. It is 1:49, so I'm going to set that, and then we move on to the date, as you can see, and the date's correct. It's 25th of March 2020. Okay, and so now we're all set with that. So next thing we're going to do is insert the test strip. So now we're going to move over to the vial, and you never want to open this vial unless you are going to be testing yourself, because if these test strips get contaminated or damaged, your reading will be off, and that of course will throw everything off. So I'm only opening it because I'm going to be testing myself, and I make sure it's closed right away. So you're going to see a side with 2 silver and 1 gold bar, so you want that to be facing you when you're inserting it into your glucometer, and you want to press it down in gently, and then you're going to see this blood droplet appear. So now we know that the glucometer is ready for testing. So now we can finally perform the test. Of course, before you perform the test, make sure your hands are washed, you're in a safe area, you have somewhere to eject the needle and safely dispose of it when you're done. So now, I'm not going to test myself today. However, if I were to test myself, it would go along the lines of this. So just bring it up and it would go quick 1, 2, 3. So 1, 2, 3. Okay. So I'm pricked. Now I have a little bit of blood, but I don't have enough. So what I'm going to do now is I'm going to massage the area around the puncture to get a little bit more blood. It should be a solid droplet. And if the blood starts dripping down your finger, it's no longer usable. So keep that in mind. So you just want a little pocket of blood right where you made the puncture. So now we can actually test. So you're going to grab the glucometer and you're going to bring the small golden bar that I mentioned earlier to the blood, and it's going to absorb it. And in about 5 seconds, you're going to see your reading. And before we discuss the reading, I want to discuss the purpose of the control solution. So most devices come with this. So what the control solution's purpose is to make sure that this glucose meter is accurately reading your glucose concentration in your blood, and it's not giving you the incorrect number. So on your test strip vial, it will show you a range that your control solution is supposed to read within when you test it, and that's how you know that it's working properly, if it's within the range. So now we can move on to the number for your test. So the number, as aforementioned, is the concentration of glucose in your blood, and this is a number for you to check for the most part several times per day, depending on what your doctor says. And it's kind of just a monitor of how your lifestyle is. So you would know that if your levels were low, or say you wake up in the morning and you haven't eaten in 12 hours, of course your levels are going to be low. If you go out and you eat an unhealthy meal, say you go out and eat pizza and drink a bunch of soda, your levels are going to be higher. So that is somewhat a reminder to yourself to, take it easy. You want your levels to be within the range that your doctor provides you. Say that you decided to stay home and instead of eating pizza, you ate a healthier meal, your levels would be likely within the normal range, and that's basically what the numbers mean. So now we want to talk about the disposal of now the contaminated needle. So what you want to do is you're going to grab the lancing device, and again, first thing you're going to do is remove the cap. Okay, so the cap is removed, and now what you want to do now is you want to press the ejector button at the bottom, and what that is going to do is you just press it, and all it does is it just completely pops the needle out. And when you pop it out, make sure that you pop the needle out onto a surface that you can access very quickly and get rid of, because you don't want this to go onto the floor or anything where an animal or a child can touch it, because then of course they're harming themselves. So as soon as you dispose of the needle, I understand that you'll be home, you might not have the Sharps disposable container that a doctor's office has. I would recommend putting it in a hard plastic to get rid of it, so maybe a laundry detergent container, and that way you're ensuring the safety of yourself and anyone else from accidentally getting pricked with your needle. Okay, and then same thing with the test strip, remove the test strip, same exact process, and then you are all set. And if you have any more questions, feel free to give the pharmacy a call. Thank you, and have a good day.